When patients feel confident that their records are private, they are more likely to disclose health details to their healthcare providers. When patient health data is not protected, it can get into the wrong hands, making the patient vulnerable to identity theft, financial loss, fraudulent use of insurance information, embarrassment, insurance problems, and inaccurate medical records. Informatics knowledge and skills can help to maintain patient trust and to prevent unauthorized access to patient data. Health information technology has been designed to help protect information through technology. Each time that a healthcare provider uses their ID and password to log into the health record, the system keeps a log of this entry. If a caregiver logs into a system and then steps away without logging out of the system, another person could easily view unauthorized information or make changes to the patient chart. There have been instances where a caregiver has accidentally documented information into the wrong patient chart by accessing a computer that was left logged into a patient chart. When there is unauthorized access to patient information or changes are made to a chart under another person's ID and password, the actions will be ascribed to the ID of the person who is logged into the system, even if they did not perform the actions. There are two ways to protect both your login information and the patient's private records when using the EHR. The computer session can be suspended, or the user can log out when stepping away. Suspending a session means that the user has closed access to the EHR and the patient chart, and the system cannot be accessed again without an ID and password. However, if the session is suspended, when the nurse logs back into the system, the patient's chart will remain open at the same spot as when the session was suspended. Logging out of the system means that the patient's chart is closed and the user is fully logged out of the computer system. If the user logs back into the same computer, the patient chart will need to be re-accessed and opened. Login IDs and passwords can be stolen and used by others. Avoid writing down an ID and password and do not store this information where it can be found by others. Sharing a login and password with others is often a violation of organizational policy. And when creating a password, do not select a word that others could guess, such as a child or pet's name. Informatics knowledge and skills are used to protect patient records and information by suspending a session or logging out of the computer when stepping away. Additionally, IDs and passwords should be protected, and a password should be complex and difficult for anyone to guess.